instead of permanent gridlock, let's invite a marketplace of ideas and competition to see what are the best approaches. What are going to be the approaches that really expand coverage and hold costs down? I'd also say I don't think anybody that I meet in a community meeting anywhere on the political spectrum wants to go back to the days when the insurance companies can clobber people who have pre-existing conditions or hit people with big co-payments when they need preventive services. So I don't think that's really on the table for the political debate coming up, going back to the days when the health insurance system only worked if you were healthy and wealthy. I don't care where you are on the political spectrum. I don't find any constituency for that. But I do find an audience in this country that says they want real reform. You hear those words again and again, and what Senator Brown and I are offering is a chance to really test those ideas that are best suited for real reform and look at what works and continue this kind of discussion at a time when the country is so divided. The other point with respect to this discussion that I think is important is we're spending enough money on health care today. I think that there is widespread agreement that we've got to find a way to more efficiencies. You know, we're spending around $2.5 trillion a year. There are just over 300 million of us. You divide 300 million into 2.5 trillion, and you could go out and hire a doctor for every 7 families in the United States. I often bring this up, not to say I'm advocating dividing up the $2.5 trillion or something, but as a metaphor. But usually after I bring it up, a doctor comes up to me and says, "Where can I go to get my 7 families?" Sounds pretty good. Well, Senator Brown and I are giving people a chance to test the ideas across the political spectrum, conservative and liberal, about who can best find their way to cost containment in American healthcare while still expanding coverage. And I would hope that conservatives look at our particular legislation and say, boy, there's some appealing stuff here. States' rights. This is something we've long advocated. And I would hope that progressive people would look at what Senator Brown and I are talking about and say, we wanted to go a single payer route. We didn't even get a chance for a hearing at that. And we're going to go to the state legislature and have a discussion about it. And by the way, I think people already know what my first choice is, and I'm not trying to dictate it to the states. My first choice is what Congressman Coleman and I proposed, which was that we thought everybody in America ought to have choices like their members of Congress. If you weren't on Medicare or in the military, you ought to be able to play hardball with your insurance company. You ought to be able to fire them if they give you lousy, coverage, because that was a marketplace. Low administrative costs, hold costs down. But I'm not trying to inflict the view that I had, along with Senator Coleman, on the states. I'm saying we had a big debate in Washington, D.C. It is clearly not over yet. If anything, most people feel it has just started. Why not use this opportunity to actually bring people together? Folks, this is the only major bipartisan effort in the United States Senate since the health bill was signed. There is no other with respect to next steps on health reform other than this. Legislation really does 2 things. It moves up the date for waivers from 2017 to 2014. The reason the states would like that is that if you keep the date at 2017, a state would have to go through the expense and the hassle of doing it twice. They have to have a system up and running in 2014. If they weren't given a chance to have this done once, they spend the money for 2014, then they have to spend the money again for 2017. Even by the logic of the Beltway, that would not exactly be ideal. The second thing the legislation does is it makes it possible for states to have their waiver applications considered earlier. We sped up the timetable, which right now continues the uncertainty about the role of the states. But I bring this up only by way of saying that if we're going to take the theme of this program you're having today, that we want some action rather than gridlock, Senator Brown and I provide a path for doing that. We're going to get hit, there's no question, by folks on the ideological extremes of American politics. There is no question that there will be folks on the conservative side who will say absolutely nothing except repeal of this legislation is acceptable to us. There will be folks on the liberal side who will say, oh, there are going to be people who are going to try to get out from under doing anything with this legislation. I can sort of see the headlines, already. By the way, you don't get to get out from doing anything. You've got to show, which conservatives and progressives have long agreed on, that you can match the federal targets. You've got to show that you can match the federal targets, and you've got to show that you can do it without spending additional funds. So to me, this is the ultimate in a reformer's opportunity. If you care passionately about ideas and you believe in them, why won't you have the guts to support something like this so you can show it? If you're a conservative person or a progressive person who's battled for your ideas for years and years, you duck something like this, you're saying you don't really want to go into the marketplace of ideas and compete to show what makes the most sense. Well, I don't think either party has a monopoly on good ideas, and I want to have a chance to continue this discussion rather than have everything come to a halt. And by the way, I don't think the country wants to just turn back the clock and do nothing on the health reform issue. The country doesn't want to go back to the days when insurance companies can discriminate against people with pre-existing conditions and simply do nothing and have year after year after year of this kind of bickering. Senator Brown and I offer what I think would be appealing at a time when the country is divided for people to say, this looks like something where the federal and state governments can participate, legislatures, governors, and people across the political spectrum. Now, I hope when they do that kind of cooperation, they'll come to the idea that Senator Coleman and I and 15 United States senators were right and said that what the country ought to have is something that looks like what members of Congress have. That was what we had a piece of legislation behind. But we're not dictating our view on it. We're sending people out across the political spectrum to have a different kind of discussion, a participatory discussion, one that says with that $2.5 trillion, maybe we've got better ideas than folks in Washington, D.C., and at least they're giving us a chance to be part of that marketplace of ideas. Norm, I don't know what your pleasure is. I'm going to have to be out the door in a few minutes. If people have any softball questions, those will be especially welcome. But, and I don't want to impose on Mike Burgess either. So,
if you have to leave, why don't you take some questions?
Great.